So when we talk about early surveillance systems for outbreak detection, that's a must-have. And in the field that I'm in within healthcare, I operate both within public health and healthcare. I want to first focus on healthcare because you often hear a lot about public health surveillance. As an example, ILI-net, where you look at influenza-like illness coming in, whether it's through emergency departments or outpatient clinics, and then you get that public health surveillance snapshot of how many Americans are sick with cold-like symptoms. Now, that's on the public health side. What's also important is that we replicate that on the healthcare side, because healthcare is where patients present. And so one of the tools that I've been helping develop with my team, along with other departments within New York City Health and Hospitals, is this early syndromic surveillance system. And we basically have 4 conditions that we've put in so far. This includes ILI, or influenza-like illness. It also tracks GI and skin conditions as well as asthma. And what it does is that it gives us an early indicator if we start seeing more patients come in complaining of influenza-like illness or rash outside the typical, for example, flu season or outside of an Mpox outbreak. So we know there's something happening. So those types of early detection tools are very important. And then you can complement that with wastewater surveillance and things like that. So those are really, really important tools. So as we talk about diagnostic, that's a really important tool in our toolbox. This is what helps diagnose whether we're talking about, influenza or something more novel like bird flu or even Ebola or other hemorrhagic viruses. So having diagnostic capability is essential. And what's even more important is having it at the bedside. When we talk about novel infectious disease outbreaks, oftentimes it's that astute clinician that suspects that this patient has this novel infectious disease. They call their local health department and then they send samples over for testing, and many times those samples are routed to CDC for confirmatory testing. What we need to do is bring much of that testing closer to the bedside, so that way we're not going through this very long process of sending samples to public health and sending it to CDC at the federal level. So the more we can bring better faster diagnostics to the bedside, the better. And we know there's a lot of work happening in this field, and it's important that we bring in frontline clinicians to ensure that they're part of the picture, because they're also going to be the front lines in helping diagnose these cases. And so any way we can bring these innovations closer to the patients and closer to healthcare would be a much effective strategy. There's a lot that we can learn from recent epidemics and pandemic. Obviously, we just ended the public health emergency for COVID-19, even though we know COVID-19 is still very well alive and circulating. The good news as we talk about COVID-19 is that its severity has certainly decreased from being the 4th leading cause of death to now the 10th leading cause of death last year. But even with that said, there's still a lot of lessons learned that we can learn from both from COVID-19 and even as recent as Mpox or the triple-demic that we experienced this past flu season with COVID, RSV, and flu are circulating at the same time. A lot of it really boils down to making sure that we have better preparedness strategies in place. We have good diagnostic tools, good surveillance tools, and we have really good science communication and health communication to the public, because epidemics and outbreaks start and end with people. And if people don't understand that there's a virus circulating in their community and there's an effective vaccine or there's effective therapeutics, then they may not get vaccinated, they may not get the therapeutic, or they may put themselves at risk and unfortunately get infected with the virus. And so what we want to do is have a kind of a holistic approach where you're bringing in public health and healthcare together to respond to these epidemics, and really making sure that we're bringing in the general public for the ride, and they understand the importance of whatever outbreak we're trying to respond to and what they can do and what their role is. We live in an age of mis and disinformation, and so it's really important that we're upfront and we're providing the information that we know faster, and we're helping address this misinformation that we know is probably already circulating. We know that by studies and different research, misinformation travels 6 times faster than true information. So oftentimes we're already behind the 8 ball. So it's important that we bring that to the forefront, and we're educating the public as we're responding to epidemics, or even looking at preventing or preparing for epidemics, so they understand the importance of the work that we do, and they're able to also take any effective resources like vaccines or therapeutics, as I've mentioned, or even diagnostics. Getting tested is really important, and they understand the value of it and what they can do to help curb any transmission. Public health is a team sport, and as we talk about responding to different outbreaks, it very much is a team sport. It's an all-of-government approach, and what this means is that you're working at the local level, at the state level, the federal level, and very importantly, the international level, because we know that these outbreaks are not just part of one community. They can expand out and become larger epidemics and even pandemics. And so it's really important that we're working with all levels of government, and everybody has transparency and data, right? Data is king. As we talk about responding to any outbreak or responding to any public health threat, data is really, really important. That's what helps inform policy. That's what helps inform where resources and funding go. It also helps us inform where are certain interventions, or what is something that's better than something else, right? And so is a mask effective against this virus, or is it something else? And so we really want to make sure that there's good data happening and good data sharing, because that gives us a better picture of how we can respond better as a community. But it very much is a whole of society, whole of government approach.